I am honored to be here today to speak at this special congress, and I would like to thank the organizing committee, especially Dr. Cornelio Popescu, for inviting me to participate. My presentation today will focus on Crimean Congo hemorrhagic fever in travelers. Also, this is a topic of significant importance as the disease has become increasingly prevalent in recent years and poses a considerable risk to those who travel to endemic areas. Regarding this presentation, I have no conflict of interest. My presentation will cover four major issues, starting with an overview of the disease. Next, I will update you on its geographic distribution and emergence. After that, I will talk about the epidemiology and risk factors of travel-related Crimean Congo hemorrhagic fever. Lastly, I will address the management of the disease in a travel setting, including the challenges that come with it. So let me first give you a brief overview of the disease. Crimean Congo hemorrhagic fever is a zoonotic disease and is primarily transmitted through tick bites. The disease falls under the category of viral hemorrhagic fevers, which share many common features. Especially in the early stages of the disease, symptoms may include fever and hemorrhage due to a decreasing in platelet count, also known as thrombocytopenia. These symptoms can be severe and life-threatening, making it critical to identify and manage them promptly. Now let's move on to discussing the various modes of transmission for the virus. In humans, Crimean Congo hemorrhagic fever infection typically occurs through tick bites or through contact with the blood or tissues of infected livestock. It's important to note that nosocomial infection or infection acquired within a healthcare setting is a significant issue in countries where the disease is endemic. Moving on, let us discuss the geographic distribution and emergence of the CCHF. CCHF is mainly found in regions that share similar environmental features, such as hot, dry summers and cold, moderately rainy winters. The land structure in these areas tends to be more fragmented, as shown in the picture, providing an ideal habitat for tick survival, especially in areas with vegetation associated with livestock grazing. As a result of these conditions, CCHF is most commonly observed in individuals working in animal husbandry and agriculture. Let us continue our discussion on the geographic distribution and emergence of the disease. CCHF is a global health concern with reported cases in over 30 countries, especially in Africa, Asia, Eastern Europe, and the Balkans, and the Middle East. In recent years, there have been reports of the virus appearing in new regions such as India and Spain. Yes, over the past 2 decades, Turkey, Greece, Georgia, India, and Spain have reported their first cases of Crimean Congo hemorrhagic fever. Turkey has been identified as an endemic country for Crimean Congo hemorrhagic fever, with a high incidence of cases reported annually, especially in summer months. The emergence of the disease is thought to be driven by several factors, including an increase in tick populations due to climatic changes, animal movements, and an increase in the number of tick-susceptible animals. Also, wild birds carrying ticks may also play a role in the spread of the virus. However, the exact interaction between these factors is complex and not fully understood. Now, let me briefly summarize the main factors for spreading of Crimean Congo hemorrhagic fever virus. The main factors contributing to the spread of the virus include the transport and trade of live animals that are carrying infected ticks, cross-border movement of animals, migratory birds, and human travel. Especially the illegal movements of animals seen on the borders of Afghanistan, Pakistan, and Iran are related in the emergence of new outbreaks in this region. So it is essential to understand and address these factors to prevent and control the further spread of the disease. We investigated migratory birth role in spreading Crimean Congo hemorrhagic fever virus through attached ticks. We detected virus RNA in ticks on migratory birds in Turkey. The similarity of the virus to genotype 4 suggests that ticks on birds may play a role in spreading the virus and causing disease outbreaks in Turkey. In addition, due to changes in climate and land use, this highlights the potential for migratory birds to spread disease over long distances, especially from Asia to Africa, Africa to Asia, or Africa to Europe. So, also now I would like to move travel-associated Crimean Congo hemorrhagic fever. We published a systematic review in 2016. Our review identified 21 cases of travel-associated Crimean Congo hemorrhagic fever, which highlights the risk associated with travel to endemic regions. However, it is important to note that this is likely to be an underestimate, as Crimean Congo hemorrhagic fever is often a mild or subclinical infection that can go undetected. So here are the features of the cases. So this slide shows a summary of the travel routes of 18 confirmed cases of Crimean Congo hemorrhagic fever. The cases include travel from Africa to Africa, Europe to Europe, Africa to Europe, Arabian Peninsula to Asia, and Asia to Asia. So one of the concerning findings from our review is the frequent occurrence of cross-border travel among cases of Crimean Congo hemorrhagic fever in endemic regions, especially in Asia. This suggests that the disease may be spreading across borders and potentially in the new areas. Individuals in the military may be at increased risk of Crimean Congo hemorrhagic fever due to their potential exposure to ticks or animals in endemic regions. Similarly, travelers engaging in outdoor activities such as camping or hiking in rural areas may also be at increased risk of exposure to tick and subsequent tick bites and crushing the ticks with unprotected fingers. Also, cases of Crimean Congo hemorrhagic fever have been described in foreign workers. The risk factors include occupation as butchers or soldiers, leather processing, animal slaughtering, and participating Eid celebrations that involve slaughtering. Additionally, cases of Crimean Congo hemorrhagic fever have been described in foreign workers who were working abroad in countries such as United Arab Emirates, Oman, Afghanistan, and Bulgaria. So, Eid al-Adha is a Muslim festival that involves sacrificing animals such as sheep, goats, camels, or cows, and sharing the meat with the poor. However, the increased contact with animals and threatens to increase the number of CCHF infections. Also, outbreaks have been reported during the festival in Pakistan, and it now takes place during the summer months when CCHF is more prevalent. So, prevention of Crimean Congo hemorrhagic fever during slaughtering practices is essential to avoid potential new outbreaks. So, how can we prevent during travel? If you are planning to travel to an area where the disease is endemic, there are some precautions you should take. Let's take a look at these precautions. Advice includes avoiding contact with rodents, wildlife, and livestock, and not handling ticks with bare hands. Wearing protective clothing is also recommended to reduce the risk of infection. To prevent transmission of CCHF, these measures are essential. Early recognition is critical to controlling the spread of viral hemorrhagic fever, so rapid diagnosis is essential for the prompt implementation of appropriate measures to control the infection. So, returning travelers. The evaluation should consider the traveler's geographic region of travel, dates and duration of stay, types of accommodation, activities, exposures, and information about the host. Additionally, the patient's pre-travel immunization status and prophylactic drug history can be used to narrow the possible cause of the febrile illness. By following a systematic approach to evaluation, healthcare, healthcare providers can efficiently rule out potential diseases and focus on diagnosing and treating the most likely causes of traveler's fever. So, another important point is international alerts. Any local or international alert for a current outbreak in the visited area also give clues for diagnosis. PROMET is an internet-based reporting system dedicated to rapid global dissemination of information on outbreaks of infectious disease. Also, PROMET is available in several languages and as regional networks. Here is the graph of the Crimean Congo hemorrhagic fever, describes the main features, clinical features, and diagnosis. So the incubation period of the disease varies from 2 to 14 days, with most cases occurring within 3 to 6 days of exposure. The disease is characterized by fever, bleeding, headache, muscle aches, and vomiting. Patients may also experience bleeding from various sides, including the nose, gums, and digestive tract. Gold standard for diagnosis is PCR testing, which allows for the rapid detection of the virus in blood samples. Serologic testing is also available, but may not be as sensitive or specific as PCR. So, understanding the incubation period and clinical findings of CCHF, along with the importance of PCR testing, is main factors for diagnosis. So, here the list of independent predictors of mortality. It includes presence of hemorrhage, impaired consciousness, central nervous system involvement, diarrhea, splenomegaly, thrombocytopenia, increased ALT levels. Also, it was shown that the viral load is significantly associated with mortality. The mortality rate of Crimean Congo hemorrhagic fever varies greatly depending on factors such as the virulence of the virus, the patient's immune system, early diagnosis and treatment, and the quality of the supportive care. This can lead to mortality rates ranging from as low as 4% to over 80%. In endemic countries, the case fatality rate typically ranges from 4% to 20%. So, diagnosing Crimean Congo hemorrhagic fever can be challenging as its symptoms are similar to other viral hemorrhagic fevers. So, physicians should keep in mind the possibility of hematologic diseases and consider CCHF as a potential diagnosis for patients, especially with hemorrhagic syndromes who have a history of tick bites, outdoor activities, or travel to endemic regions. By doing so, healthcare providers can make an accurate diagnosis and provide appropriate treatment for patients with viral hemorrhagic fevers. So another important point is the incubation period. The length of the incubation period for CCHF can help narrow down the list of possible diseases. Now let's take a closer look. The patient's departure and return dates can define the possible range of incubation periods. For example, diseases with incubation periods shorter than 2 weeks, such as viral hepatitis, amoebic liver disease, visceral leishmaniasis, and tuberculosis, can be excluded. Similarly, Diseases with incubation periods longer than 3 weeks, such as dengue, rickettsia, and hemorrhagic fevers, can be ruled out. By understanding the incubation periods of different diseases, healthcare providers, doctors can more efficiently narrow down potential causes of febrile illness in a traveler. So, what about the treatment of Crimean Congo hemorrhagic fever? Unfortunately, there's currently no specific treatment or vaccine for Crimean Congo hemorrhagic fever. So, what are the best management practices? The standard treatment of Crimean Congo hemorrhagic fever is intensive monitoring and supportive treatment. Management of CCHF includes careful attention to fluid balance and electrolytes and mechanical ventilation if it is needed, hemodialysis, vasopressor use, inotropic agents could be used if it is required. In several cases, blood product replacement may be necessary, but limited access to blood products in rural areas can pose a challenge. It is critical to improve blood systems in developing countries to provide adequate, safe, and timely blood product supply. Now, let's move on to the next topic. It is important for healthcare providers to be aware of the symptoms of Crimean Congo hemorrhagic fever and also other viral hemorrhagic fevers, and obtain a detailed travel history for patients presenting with a fever and hemorrhagic symptoms. Prompt diagnosis and management, including isolation, and appropriate infection control measures, can help prevent the spread of the disease and improve patient outcome. Another important point is contact tracing. Contact tracing plays a critical role in controlling the spread of CCHF. Let's examine why it's so important. It helps to identify potential contacts, assess exposure risks, and ensure early detection of secondary cases. Also, contact tracing plays a vital role in preventing further spread of the disease by implementing infection control measures such as isolation and barrier precautions. Contact tracing is a priority in order to effectively manage outbreaks and prevent the spread of Crimean Congo hemorrhagic fever. So, when conducting contact tracing for Crimean Congo hemorrhagic fever, it is important to identify specific target groups. These groups include travel companions, household members, and healthcare workers who provided care for patients. Identifying and assessing the exposure risk of these individuals can help prevent further spread of the disease and aid in the early detection of secondary cases. Now, this is my last slide, and I would like to summarize the main points of my presentation. CCHF is a growing global concern and emerging zoonosis that can be spread through climate change, animal movements, and migratory birds. Early diagnosis is essential in returning travelers, and obtaining a detailed travel history can help determine the risk factors for infection. Early clinical assessment of the severity of infection also is critical, and early management and isolation of the patient can help prevent further spread. It is important to inform infectious disease and clinical microbiology teams, as well as public health officials, to ensure appropriate action is taken to prevent further transmission of the disease. Thank you very much for your kind attention.